Welcome to the GRU Cancer Center Chemotherapy Class. If you're viewing this presentation, your team has probably recommended chemotherapy as part of your treatment plan. In this class, we will discuss what chemotherapy is, how it works, how chemotherapy is given, side effects, how to manage the side effects, and how to maintain a positive and healthy attitude while receiving your treatment. We will also discuss what resources you have available to you. What is chemotherapy? Drugs used to treat cancer are called chemotherapeutic agents. Treatment with drugs used to kill cancer cells is called chemotherapy. There's also another type of treatment called biotherapy. Biotherapy is a type of treatment that uses substances made from living organisms to treat disease. These substances may occur naturally in the body or may be made in the laboratory. Some biotherapies stimulate the immune system while others suppress the immune system, helping your body fight the cancer, infection, or other diseases. Other biotherapies attack specific cancer cells which may help keep them from growing or may kill them. Biotherapy is often used in combination with chemotherapy. How does chemo work? Chemotherapy works to destroy cancer cells within your body. The medicine targets rapidly dividing cells within your body. Most cancers involve rapidly dividing cells, which support the cancer growth. Different medicines affect different life cycles of the cancer cells. Chemotherapy can be given alone. It can also be used in combination before surgery or after surgery, before radiation or after, and sometimes chemotherapy and radiation are given at the same time. There are many different types of chemotherapy drugs. There are oral agents, topical such as a lotion, an injection into the skin, intravenous by injection or a longer infusion, intrathecally, and intraperitoneal. Intravenous chemotherapy. Most of the treatments received at the cancer center will be infusions or injections. The chemotherapy is given through a vein directly into the bloodstream. It does require an IV catheter or other type of access to your bloodstream. Your physician will write the orders for your treatment prior to the treatment beginning. The insurance company is contacted for approval prior to starting chemotherapy. Chemotherapy is often given in cycles. The first day of each cycle is called day 1. The days in which you receive no chemotherapy are called your rest days. Your doctor will tell you how often your cycles will repeat. For example, many patients receive chemotherapy on day 1, and that cycle is repeated every 21 days for a predetermined length of time as determined by your physician. Checking in for your treatment. Currently, we ask that you please stop at the front desk and check in for every treatment. You will then go to the second floor and they will log you in as arriving. This notifies the nurses in the back that you have arrived for your treatment. If you are seeing the doctor that day, you may see the doctor first and then you will proceed to the second floor for your treatment. Most often you will have labs drawn either the day before or the day of treatment. Lab values are generally required before each cycle of chemotherapy. However, if you are receiving treatment every day that week, you may only need labs on the first day of the week. This could include laboratory values such as blood results and/or urine samples. We encourage having labs drawn the day before to minimize the amount of time you have to wait on your treatment to begin. The Infusion Suite has 30 chairs and 6 beds available for patients. Each patient will have a chair, 2 visitor chairs, and a television with headphones. There is a snack area with beverages and light snacks. We do ask that if you plan to be in the area for a long period of time that you bring your own lunch. There is an outdoor veranda and you are welcome to go to the veranda as long as the nurse knows where you're located. And there are patient restrooms on the second floor. Most treatments proceed as follows. You will arrive to the second floor. The nurse will be notified that you are waiting. The nurse will call you back to the back and access either an IV catheter or your portacath. Your labs will be drawn and sent to the laboratory which is on site. Once your laboratory results are back, we will compare this to the parameters on your chemotherapy orders. If the laboratory results fall within your parameters, the medication will be ordered from the pharmacy. If your laboratory results fall outside of the parameters, we will need to contact your physician to make sure it's okay to proceed with treatment. The order is scanned to the pharmacy, and the pharmacy starts working on your chemotherapy. Please understand that the pharmacy does not make chemotherapy in advance. Once the medication has been ordered, the nurse will give you any pre-medications if they have been ordered. The nurse will then give you the chemotherapy once the medication is received from the pharmacy. When you have completed your treatment, the IV catheter will be removed or your portacath will be deaccessed. At this point, you are ready to leave infusion and you can check out at the front desk. We do ask that you check out at the front desk after each appointment to make sure that you have your next appointment. Side effects. Chemotherapy affects cancer cells, but it also affects other rapidly dividing cells within your body. We like to tell patients that chemotherapy cannot tell a good cell from a bad cell. It only targets specific cell cycles and kills that cell. Unfortunately, this can have some side effects. Certain areas are most often affected by chemotherapy. This includes your bone marrow, your digestive tract, your reproductive organs, or your hair and skin. Your bone marrow can be affected by chemotherapy. Therefore, we monitor your blood counts and watch for infection. Chemotherapy causes bone marrow suppression. Some agents are worse, causing more bone marrow suppression than others. White blood cells help protect your body from infection. Red blood cells help carry oxygen to all parts of your body. And platelets help your blood clot if you are cut or are bleeding. White blood cells help your body fight infection. When your white blood cells are low, you are at a greater risk of developing an infection. You will not have any outward signs that your blood count is low. We will monitor your white blood count when you come in for treatment. If the count is too low, we will notify you. Learn how to protect yourself from infection when your white blood count is low. Red blood cells carry oxygen to your body. If your red blood cells are low, you may feel very tired and become very fatigued easily. You may become short of breath when performing activities, even simple activities such as walking across the house or climbing a short flight of stairs. Please notify your physician or team of any fatigue and shortness of breath. Your platelets help your blood clot. You may be at risk of bleeding if your platelet count is too low. We will draw your labs and monitor your platelets if it is one of the side effects of your chemotherapy. We do ask that you avoid risky activities that could lead to cuts or breaks in the skin. Avoid razors if your platelet count is too low. Notify your team of any unusual bleeding or bruising that is unusual for you. We would also ask that you avoid aspirin or drugs like ibuprofen unless the physician has said that this is okay. How can you protect yourself? The most important thing you can do to protect yourself from an infection is washing your hands. You may also need to avoid large crowds, avoid sick people, monitor your temperature daily. We do ask that you have a thermometer at home and take your temperature every day. Practice good mouth care, bathe daily, and try to avoid cuts or breaks in the skin. If you have a central line, such as a port, a Hickman, a PICC line, or an apheresis catheter, it is very important that you learn how to take care of this line. Your central line can be a major source of infection and should be kept clean and dry at all times. Ask your nurse how you need to care for your line. Signs of an infection that need to be reported to the physician would be a temperature of 100.5 degrees Fahrenheit or greater, chills, shaking, or unusual sweating, pain or burning when urinating, coughing or drainage from your sinuses or coughing up colored sputum, drainage from a wound. Please call your physician if any of these signs or symptoms are present. When should you call your physician? If you have any of the signs of an infection listed on the previous page, or if you just generally do not feel well, we would prefer for you to call. Do not wait for the fever to go away on its own. If you have had a fever for more than a few hours, we would prefer for you to call triage immediately at 706-721-6748. If this is after hours, 706-721-6744. We would always prefer that you err on the side of caution and call. You may experience fatigue during your chemotherapy. This can be a general result of chemotherapy. It can be a result of your disease. And fatigue can be a general physical and or mental tiredness. Some days you may feel so tired that you don't feel like getting up and moving around. Ways to fight fatigue: balance your rest with activities. Plan more energetic activities early in your day. Rest if you need it, but try to limit naps because this can interfere with your sleep. Exercise regularly. We like to tell patients to rest when they need it, but also try to keep up your stamina, whether it's walking to the mailbox, general light housework, but try to maintain some exercise. Eat a balanced diet and drink plenty of non-alcoholic, non-caffeinated beverages. Please tell your doctor if your fatigue is severe. Mouth care. Chemotherapy can cause many changes in your mouth, including ulcers, soreness of the mouth, infections in your mouth, changes in your saliva, and changes in your taste. Many patients complain that food may taste metallic or have very little taste. You may need to see a dentist prior to starting chemotherapy. It is important, if you have ongoing dental issues, you notify the healthcare team and let them know. Sometimes chemotherapy must be delayed in order for oral problems to be taken care of. Start a good mouth care regimen immediately. Brush your teeth with a soft toothbrush at least 3 times per day. And rinse your mouth with a simple mouthwash of baking soda and warm water. Many chemotherapies can cause alterations in taste. This can be bothersome for many patients. Drinking through a straw may help. Avoid metal utensils. Avoid drinking from a metal can. And try many different foods. Some foods that you liked prior to chemotherapy may not taste good while you're taking the treatment, but other foods that you didn't like in the past may taste good to you at this point. So try a number of different foods. If your mouth is sore, how can you care for it? Soft, bland foods may feel better on your mouth. Try drinking through a straw to have less contact with the mouth tissue. Avoid acidic, salty, or spicy foods. Avoid food that is sharp or with rough edges, such as potato chips. Avoid food or drinks too hot or too cold. Tell your team if your mouth is preventing you from eating or drinking. Chemotherapy can cause side effects in your digestive tract. The most common are nausea, vomiting, constipation, and diarrhea. Many chemotherapy agents can cause nausea. Some may cause immediate nausea, while others may cause delayed nausea. Sometimes the nausea can last for several days. Ask your doctor or nurse if the treatment they have planned is likely to cause nausea for you. If so, medication will be prescribed prior to your treatment. If you are about to start treatment and you have not been prescribed nausea medication, please contact your nurse navigator or the triage number. Here are just a few tips to help control nausea. Try to eat small, frequent meals throughout the day versus 3 large meals. Take your anti-nausea medicine as prescribed by the physician. Try to avoid fatty or spicy foods, which may increase your nausea. Take your medicine 30 minutes prior to your meals, so you'll enjoy your meals more. Drink plenty of fluid. And if your nausea is severe, you may want to do what's called a dry diet, where you have your fluids between the meals, not at the same time that you're eating your meal. Diarrhea and constipation are often side effects of chemotherapy. Some chemotherapy agents list both as a possible side effect. With many patients, we do not know if they will develop diarrhea from the chemotherapy or constipation. Some patients can experience both during their treatment. Always tell your doctor if you either have diarrhea or constipation. Tips on managing diarrhea. It is recommended you drink at least 8 to 12 8-ounce cups of non-alcoholic, non-caffeinated fluid per day. Alcoholic and/or caffeinated beverages can actually increase the amount of fluid you urinate each day, causing dehydration. Avoid high-fiber, high-fat foods. Avoid milk or milk products. Increase your intake of foods high in potassium or sodium if this is allowed. Your team may tell you it's okay to take Imodium AD as directed on the label. If your diarrhea is severe, you may be prescribed other medications. Tips for managing constipation. Again, drink 8 to 12 8-ounce cups of non-alcoholic, non-caffeinated fluid each day. Try to eat a well-balanced diet, including lots of fruits and vegetables. Docusate sodium, which is the generic name for Colace, can often be taken to help relieve occasional constipation. Ask your team if you can add other stool softeners or laxative before you take them. When you should call the physician. If you have not had a bowel movement in 3 days, notify your healthcare team. If you have had 4 or more loose stools in 1 day, please notify the healthcare team as diarrhea can become severe. If your diarrhea is severe, you may need to go to the emergency room if it is after hours. If it is during normal hours, you may be asked to come into the clinic to receive intravenous fluids if needed. There are other side effects you may experience during chemotherapy. Chemotherapy can affect skin, hair, and nails. Hair loss can be a side effect. It may affect your sexuality. You may experience peripheral neuropathy, and you may have problems with your memory or concentration during your treatment. You may develop dry skin as a result of chemotherapy. Some patients will develop a rash, and there are certain medications which are known to cause a rash. Your team will discuss this with you prior to receiving those medications. Many chemotherapy agents will make you more sensitive to the sun. You can develop dry, brittle nails, or a discoloration of the nails. Caring for your skin and your nails. Use mild, gentle soap. You may need to switch your soaps to an unfragranced, very mild soap during your treatment. Regularly apply a gentle lotion to your skin. You should apply sunscreen whenever you go outside, as you will be more susceptible to sunburn. You may need to wear long sleeves and a hat if your medication makes you more susceptible to sun. File your nails instead of cutting them, and you should wear gloves when gardening. Some chemotherapy medications can cause partial or total hair loss. The hair loss can be limited just to the head, or it may affect all of the hair on your body. Some people will only experience a thinning of the hair. Most of the time, your doctor can tell you in advance whether or not you will experience complete hair loss before beginning treatment. If the chemotherapy regimen you're receiving causes hair loss, this generally occurs within 7 to 21 days. The hair loss is usually temporary. Most people will start regrowing hair within a month or 2 after stopping treatment. Some patients will regrow hair even while they're on treatment. Here are some suggestions before hair loss. Wash your hair very gently. Many people have very sensitive scalps before the hair falls out. You may want to go ahead and cut your hair shorter in preparation for the hair coming out. If you notice a lot of hair coming out at one time, many people will go ahead and shave their head with clippers. And you may want to buy a wig in advance of the treatment to be prepared for your hair falling out. Coping with hair loss. You should always apply sunscreen to your scalp when you're going out in the sun. The skin on your scalp will be much more sensitive than the rest of your body when you're in the sun. You will need to wear a hat to protect your scalp. You may wish to join a support group. We recommend that you visit the Image Boutique on the first floor of the Cancer Center. They have very useful tips on fitting for wigs, ordering wigs. They can often assist you with getting a prescription for the wig. And they also offer a Look Good, Feel Better class, which is targeted towards women dealing with cancer treatments and/or hair loss. Your sexual health can be affected during the course of chemotherapy. It can cause changes in your reproductive system. Some medications also affect the hormone levels, which may cause a decrease in sexual desire during treatment. This may cause erection changes in men and vaginal changes in women. General side effects from chemotherapy, such as fatigue, nausea, vomiting, can also affect your sexuality. Sexual health for men. Chemotherapy can often cause temporary or permanent sterility. If you still desire to have children, please talk with your team about sperm banking prior to starting chemotherapy. The treatment may make it difficult to get or keep an erection. If you are having problems, please notify the healthcare team. You may also be too tired or too stressed while undergoing treatment to feel like having sex or having an intimate relationship with your partner. You should not get anyone pregnant while taking chemotherapy. Always use a condom if your partner is of childbearing potential. And use a condom while having sex because chemotherapy can be excreted in your semen, and this will protect your partner. Women should not become pregnant while receiving chemotherapy. If you are of childbearing age, you must use a double barrier method of contraceptive while receiving your treatment. Discuss any concerns you may have about sterility and/or fertility with your doctor prior to starting chemotherapy. You may need to see a reproductive specialist if you still desire to have children after your treatment is finished. Many chemotherapies can cause irregular periods. Sometimes your menstruation will stop completely during chemotherapy and it may not come back. It can cause vaginal dryness, vaginal atrophy, and hot flashes associated with menopause. Many women are put into menopause by the chemotherapy because it affects the hormones. Please discuss any of this with your physician. Ways to cope with sexual health problems. Discuss any concerns about your sexual health with a member of your healthcare team. It is important to maintain good communication and loving expressions with your partner to help retain intimacy in your relationship. Schedule an appointment with a sexual health therapist at GRU Cancer Center to learn how to cope with the sexual health issues you may experience during chemotherapy. Chemotherapy can also cause changes in memory. Many people jokingly refer to this as chemo brain. Chemo brain is a term used to refer to problems with concentration or remembering during your chemotherapy treatments. This can also continue after treatment is over. Stress, other medicines, or your cancer can also contribute to changes in your memory. Tell your doctor if you are confused, very sad, or very depressed. Let your doctor know about any memory changes you are experiencing. Here are some tips for dealing with memory changes. Write down important dates or appointments on a calendar or an appointment book. Write down or record your important thoughts in a journal so you can remember them later. Use a pill box or a calendar to keep up with your medications. When you feel your best, try to do tasks that require more concentration. And most of all, try to get plenty of rest, as this can affect your memory and/or concentration. Another side effect that can occur with certain chemotherapies is called peripheral neuropathy. This can be described as a tingling, burning, or weakness in your hands or feet. It can interfere with the ability to pick up objects, especially small objects. It can cause dizziness or trouble maintaining balance. It can cause numbness in your hands, feet, or legs. This can make walking more difficult, or this can make picking up objects or buttoning a shirt harder. Peripheral neuropathy can also cause trouble hearing because it affects the nerves. Please tell your doctor if you are experiencing any signs or symptoms of peripheral neuropathy. Let your infusion nurse know if you develop any symptoms. Call immediately if you have problems with ringing in your ears or trouble hearing. Here are some tips for dealing with peripheral neuropathy. Preventing falls is very important. If you're having any numbness or weakness in your legs, move rugs out of the way, wear sturdy shoes, use a cane or walker. You can place rails in the hallway or the bathroom to help steady yourself, and use bath mats in the tub or shower. You need to protect your hands and feet if you have peripheral neuropathy. You should inspect your feet every day for cuts. Wear shoes inside and outside the house. This is important because sometimes you cannot feel your feet and you don't know if you've stepped on something hot or cold or sharp. It's important to wear gloves when working outside or in the kitchen. And ice packs may help your hands or feet feel better. Ask someone to check the water temperature for you because you may not be able to judge the temperature appropriately. How do you cope with chemotherapy? You may feel anxious, angry, or depressed. You may feel all three at the same time. It's important to talk to your team about any emotions that you're having during your treatment. We encourage you to talk openly with your family and friends about the experiences that you're going through. You may also wish to talk to the social worker or the chaplain. If at any time during your treatment you wish to speak to someone, let us know and we will contact the appropriate personnel. Talk to others going through the same journey. We have many support groups available which will bring together people experiencing the same type of diseases and or treatments. And most importantly, please don't be afraid to ask us for help. We are here to help you. Some ways of coping are yoga, music therapy, aromatherapy, meditation, massage, acupuncture, and art therapy. Many of these programs are available within the Cancer Center. Please ask your nurse navigator what options you have for ways of coping. Nutrition is extremely important during chemotherapy. We want you to maintain a healthy weight, maintain muscle, and maintain your hydration. Ways to improve your nutrition. You may try to eat small, frequent meals throughout the day versus 3 large meals. Drink plenty of liquids to maintain your hydration. We encourage you to eat a well-balanced diet, including fruits and vegetables. And talk with the dietitian. The dietitians will meet with every patient at the beginning of each treatment to make sure that the diet is adequate. If you are losing weight, the dietitians will monitor this and come speak to you about your diet. If at any point you feel that you need to speak to the dietitian or you need extra tips on how to maintain nutrition, please let us know and we'll be glad to contact them for you. There are many resources that we have available for you to help you through this journey. We have social workers who are specialized in helping guide you. We have support groups. Some support groups are general and other are specific to the disease. For example, we have a bone marrow or blood support group. We also have a breast support group. We have a resource library available which has information on many different diseases, many ways of coping, and there's internet access if you need to look up something specific while you're in the Cancer Center. Your nurse navigators are a very valuable resource to you. They help guide you through the system from the point of referral until survivorship. They are there to help you. And the entire healthcare team is there as a resource for you. From the front desk to the nurse in infusion, to the nurse putting you in a room to see the physician. Please ask for help from any of these personnel. We are here to help you. Other places to gain resources, you can visit our website. We have many valuable resources and links posted on the website. You can also go to the website and help develop a wellness plan. Other websites that we trust and recommend are cancer.gov and cancer.org. I would like to thank you for participating in the chemotherapy class. If you have any questions or concerns after watching this video, please feel free to contact your nurse navigator or speak to someone in the infusion area. Thank you.